Good evening. I'm Larry Churchill. It's my very pleasant duty to welcome you to this, the GIFT Initiative's first community program. The reason for creating the GIFT Initiative is really quite simple. We want to encourage and promote a discussion around end of life and the importance of advanced planning for end of life. This is a volunteer effort. We are a group of individuals representing a very wide range of organizations in the community. And from various perspectives, we know, as you also know, the kind of suffering that patients and families and frequently the health professionals caring for them go through when there has been no advanced planning and the subject of death and end of life are not discussed. So the GIFT Initiative is a major effort to try to change that. We are sponsored and are very grateful for support from the Humana Communities Benefit Fund and also from the First Tennessee Foundation. We have planned this event around Health Care Decisions Day, which is April 16, and this coincides roughly with Income Tax Day. We're honoring Ben Franklin, who said, as you know, nothing in life is certain apart from death and taxes. But we Americans may have an especially hard time broaching conversations about end of life. The British historian Arnold Toynbee is famous for saying, among other things, that death is un-American. And it's been observed that while the Victorians talked endlessly about death and avoided all mention of sex, contemporary Americans seem to be obsessed with sex and very rarely discuss death. Whether that's progress or not, I'll let you determine. One compelling reason for engaging in this conversation is that there is a major disjunction between how most of us say that we want to die and how we are very likely to die if we don't have advanced care planning. 8 and sometimes 9 of every 10 people in surveys say that they want a death at home, attended by family and close friends with attention to pain relief and comfort, and surrounded by the things that have given their lives meaning. But currently, more than 60% of all deaths in the United States occur in hospitals and many more in extended care facilities, often with little chance to say goodbye, thank you, I love you, or all the kind of things that most of us imagine are part of an appropriate and fitting end to our life. Frequently, we have been beyond communication if we die in a healthcare facility and caught in a cycle of treatments where care is subordinated to cure, and there are lots of reasons for this, of which you are well acquainted. Also, too often we carry into these situations the fantasies that inform popular medical movies and TV programs, where resuscitation works miraculously 85% of the time. Someone really did a study about this. And people walk out to resume their previous lives. In fact, in cases of severe illness, fewer than 5% of us will actually get up and walk out of a hospital. And a majority of us may not even survive a resuscitation attempt. Meanwhile, only 3 in 10 Americans have signed any kind of advanced care planning documents, which means also very likely they have not had the discussion with their family or other people they expect to be at the deathbed.